Welcome to the Weight Loss Institute of Arizona. I'm Dr. Jason Richardson, and I'm one of the bariatric surgeons at the Institute. The Weight Loss Institute of Arizona is a highly specialized team of medical practitioners who have come together from across the nation to develop something very unique, a practice dedicated to the surgical treatment of obesity. Over the next few minutes of this video, you'll meet a few of the many individuals at the Institute who have dedicated their careers to supporting you during your weight loss journey. We will introduce you to bariatric surgery, a revolutionary treatment for obesity that has dramatically improved the lives of hundreds of thousands of people all over the world. We'll discuss some of the risks and benefits of surgery and describe the steps that often occur before, during, and after surgery. Obesity is one of the most dangerous and most underappreciated issues facing society. The effects of obesity are so profound because it contributes to the development or worsening of so many other debilitating medical conditions that can and often do lead to early deaths. Deaths that might have been prevented by the type of weight loss facilitated by bariatric surgery. Coronary artery disease, diabetes, gastroesophageal reflux, hypertension, infertility, and sleep apnea are just a few of the many life-altering medical conditions that have been shown to improve or resolve completely in many patients after bariatric surgery. Imagine a single surgery that can help some patients get off of many of their medications while at the same time living longer and healthier lives. It is amazing, it is revolutionary, but it is real, and approximately 1/3 of Americans are candidates. Determining whether or not you are a candidate for bariatric surgery begins with calculating your body mass index, or BMI. To determine your BMI, find your height at the top of the BMI chart and your weight at the side of the chart. The number where they meet is your BMI. For example, a person who is 5 foot, 7 inches tall and weighs 254 pounds has a BMI of around 40. Take a moment to calculate your BMI. Doctors and many insurance companies have determined that patients must have a BMI greater than 30 and a related medical issue before they are considered to be candidates for bariatric surgery. If a patient has a BMI greater than 40, then no additional related medical issues are necessary. At the Weight Loss Institute of Arizona, you must also be over the age of 18 years, have been overweight greater than 5 years, and have failed previous attempts at non-surgical weight loss. Each patient's past medical history might also affect their candidacy for surgery, which we can explore during their initial consultation. Gastric banding has been used successfully for over 2 decades to treat obesity. The surgery involves placing a flexible band around the top of the stomach. The band is attached by a thin, flexible tube to a small port deep within the abdominal wall. Fluid can be added or removed through the port to tighten or loosen the band. This reduces the speed of food passing through the top portion of the stomach. This is a popular surgery because of the excellent average weight loss, very low complication rates, adjustability of the band, and the reversible aspects of the procedure, which is unique to this procedure. Roux-en-Y gastric bypass is one of the oldest bariatric surgeries. It has been modified and improved over the past 4 decades. We still use it because it demonstrates excellent average weight loss and a low complication rate. The surgery involves dividing the stomach into 2 parts, a small stomach pouch and a separate large remnant stomach. The small stomach pouch is then connected to the intestines in such a way that food bypasses or avoids the large remnant stomach. Fluid from the large remnant stomach, liver, and pancreas then meets with the ingested food at the Y-shaped intestinal anastomosis, or connection. This reduces the amount of space within the stomach for food and allows the food to bypass a portion of the intestines that would normally be helping to absorb food. Sleeve gastrectomy is one of the newest surgeries for the treatment of obesity. However, similar surgeries have been performed for other reasons for nearly 100 years. The surgery involves removing the outer portion of the stomach from the patient. This reduces the amount of space within the stomach for food. Although still a new procedure, this surgery has demonstrated excellent average weight loss and a complication rate even lower than Roux-en-Y gastric bypass. Other surgeries are also performed by the surgeons at the Weight Loss Institute of Arizona and can be discussed in more detail during your consultation. The benefits of bariatric surgery can be profound. Depending on the patient's medical history and the specific type of surgery performed, some patients lose, on average, around 45 to 70% of their excess body weight within 2 years of surgery. Unlike traditional diet plans, this weight is often less likely to return in the future. Perhaps even more important, than the amount of weight lost are the dramatic improvements in medical conditions that are frequently seen after surgery. As with nearly any medical treatment, there are risks to bariatric surgery, although your physician will discuss this in more detail later. In general, some risks are common amongst all of the surgeries, whereas some risks are specific to individual procedures. When considering the risks of any medical treatment, it is very important to also consider the risks of doing nothing. Remaining obese for the remainder of one's life has very real, very severe risks, and has been shown to dramatically reduce the quality and length of one's life. After taking this into consideration, many patients decide that bariatric surgery is one of the best life choices that they can make.
Hi there, my name is Courtney and I'm one of the registered nurses here at the Weight Loss Institute of Arizona. We are all glad you are here today to begin your successful journey to weight loss. Bariatric surgery has proven very successful as demonstrated with the pictures on our walls of numerous patients who have achieved their weight loss goals. I want to take a moment to explain the steps that you will undertake before and after surgery. Usually the first step is attending one of our information seminars. Next, you will attend the first consultation in one of our offices. During that consultation, you will meet with many of our staff members who will be guiding you through your weight loss journey. You will be set up for a few quick preoperative tests such as lab tests and an EKG. Over the next few weeks, you will attend a handful of diet and exercise visits where you will meet with our dietitian and physician who will review your progress. Around 2 weeks before your surgery, you'll have a final pre-op appointment just to make sure that everything is ready for your surgery. One of our nurses will review the preoperative instructions with you, and you will receive any prescriptions that you might need around the time of your surgery. On the day of your surgery, a few hours before your scheduled procedure, you'll be welcomed into the surgical facility by your nurse and the other staff members. They will prepare you for your surgery. Our surgeons and anesthesiologists will speak with you before your procedure. Unlike the great majority of surgical practices that use only one surgeon at a time, we here at the Weight Loss Institute use 2 surgeons in every bariatric surgery. Depending on the specific surgery performed and each patient's personal medical history, many patients are discharged between a couple of hours and a couple of days after surgery. You will have your first post-operative appointment within 1 to 2 weeks after surgery. Deciding to have bariatric surgery is a journey, and all of us here at the Weight Loss Institute are excited to join you in the entire process. We want you to feel comfortable and confident with all of our staff. We really pride ourselves in always being there for our patients. At any time, if you have a medical question, you can call the office and speak with a nurse. Dietary questions? We have our dietitians available for you. And of course, your doctor is always willing to see you or answer any of your concerns. If you are pursuing surgery through insurance, there's just a couple of things that I would like to mention. There is certain criteria that is dictated by the insurance company, such as the number of diet visits and years of medical records needed in order to submit the case for approval. We will review what is required for your insurance company today during your initial appointment. Our medical assistants here work very hard to building your case to get it ready to submit to the insurance company. If you have any questions about your medical records or testing, you can call or email them at any time.
Hello, my name is Mike, and I am one of the registered dietitians here at the Weight Loss Institute of Arizona. We have 3 dietitians on staff, and one of us will be meeting with you at each appointment to be sure you receive all the necessary nutrition and exercise information to be successful with your bariatric surgery. We have designed a comprehensive support program to help you learn how to use your bariatric surgery to achieve maximum results. A few of the highlights of this program include monthly support groups held around the Valley, including on Saturdays. These groups feature various health professionals as guest speakers and open discussion amongst the patients in attendance. If you are unable to attend the groups in person, they are broadcast live for viewing from home on the internet and can be viewed anytime at your convenience. We use social media as a portal for allowing you to communicate with thousands of our patients online. Our online discussion board includes recipes, contests, monthly challenges, and provides you with the opportunity to ask questions of other patients, as well as contribute answers and support. We also have bi-monthly newsletters to keep you up to date on all the newest information. Our dietitians are easily available with any questions by phone or email. It is important that you understand your relationship with food and your own personal eating behaviors. We are going to work together to change these so you can be successful following your bariatric surgery. These foods represent an approximate portion size for the average adult for dinner. Government surveys show the average American adult eats about 2,300 calories per day. Many meals can easily exceed 1,000 calories in over 3 cups of food. After your bariatric surgery, we are going to limit your food intake to between 1/2 cup and 1 cup per meal or snack. This will almost guarantee a total daily caloric intake under 1,200 calories. You are going to still have a full plate, except it will be this size. These are some examples of portion sizes of foods that you will be consuming. We will want you to eat lots of lean proteins such as chicken, fish, eggs, and low-fat dairy, along with fruits and vegetables. In addition, we will discuss the importance of mono and polyunsaturated fats in your diet to maximize your health and your weight loss. We will instruct you on the correct vitamins and minerals to take after surgery and why you need to take them. You will have the option of using a body tracking device, such as the one that I am wearing, to track your caloric expenditure through activity. This device will allow you to enter your foods into an online database so you can keep track of your calories consumed. Our dietitians will be able to track this data to better assess your needs and advise you on any changes needed. As for exercise, no weight loss program would be beneficial without it. Your first goal, especially if you are not exercising, is to begin a program. We will discuss this and work on a plan that you will be able to do. Cardiovascular exercise will help strengthen your heart muscle before surgery. Once you are recovered from surgery, we will have you meet with your exercise physiologist to create an exercise plan for you. To prepare you for your surgery, we will give you a list of practice diet goals to follow. Once you are ready for your surgery, and it is scheduled, we will start you on a special pre-surgical diet. This is a strict diet designed to put your body into a fat-burning state. Protein shakes are an essential component of this diet, and our office offers supplements available for purchase. After surgery, we will discuss the stages of diets to help regulate you back to a normal eating pattern. The first week after surgery will be strictly liquids, followed by pureed or blended foods the second week. Our dietitians will review this with you in more detail during your appointment.
Although bariatric surgery has proven to be a very powerful tool in the pursuit of improved health and wellness, it often works best when patients are highly motivated. The more patients invest into their weight loss, the greater success they usually achieve. All of us here at the Weight Loss Institute will be looking forward to supporting you during your progress. We understand you are here to begin a healthier life and regain your life back. We are here because we want to help you from beginning to end.
All of us at the Weight Loss Institute of Arizona want to congratulate you for visiting with us today and taking a very important step towards becoming a healthier you.